Yeah, I just wanted to make sure. Okay.
We are green confused.
Good, how are you?
Oh, you're fine. No, no.
I think they probably thought I was making it up.
No, you're not confused. I'm not. You are solid.
All right, so the plan is, commissioners, first,
Well, how are you? Good.
Tall, Jason,
I'm over here.
yep.
I moved, I was over there. No.
Well, the last couple times we've been lying along the windows.
Ah.
And then, depending on, sheriff, if he gets here, and if not, I've got a couple things to put out, and, Dave Huffman gave me a couple things he'd like me to share.
Can't sit next to this guy. He is very.
Somebody should come.
Cracks me up.
So he wants to do that again. Do you mind that to come over?
I don't know if it needs to line up.
Good afternoon. Good afternoon. I'm Commissioner Scott Metzger. On Friday, June the 5th, Lycoming County was designated to go to the green phase. And over the past 3 months, Lycoming County has been very active. County government has put out 10 different directives, has had numerous press conferences to keep our citizens advised of what's taking place. Every day, our senior leadership teams meet 1 o'clock via the telephone. Weekly, we meet with our row officers to go over issues that are taking place within county government. And we have a planning cell coordination team that meets twice a week to go over issues regarding county government. As of today, the county buildings are open. They prefer by appointment only. They will not turn away members of the public if they do show up at their buildings, however. But they prefer appointments by only for now. The reason why we ask for appointments by only is because we do not want a mass amount of people arriving at the courthouse and other buildings. So we ask for that. What the green phase means for Lycoming County, it means that we enter into a step forward. Green means go, but it's not our final destination. And our final destination is home. Home where our county residents feel secure and safe. Home where we make our own choices of what we want to do on a daily basis. Whether we enter their business or we don't enter it. We want to allow that up to each member of the public. We understand that due to the state guidelines, most of these buildings are at 50% capacity. However, that is not sustainable. A business cannot operate on a long-term basis at 50%. We recognize that with our restaurants and our hotels and our other businesses, that they cannot be successful if they have one hand tied behind their back. So we will continue to fight on behalf of our businesses and our citizens to make sure that they're open, that people have a place to be employed in Lycoming County, and that we return back to the normal, beautiful county that we all love to call home. So at this time, I'll have Commissioner Rick Mirabito come up and speak. We have a list of different individuals who will be speaking today. We've been in close contact with UPMC throughout this crisis and the chamber, and we will have them also speak on the county's behalf today and what's going on with their agencies.
So one of the questions that we hope to shed light on today is, what does the green phase mean? What does the future hold? No one has a crystal ball. In my mind, to appreciate the green phase, it helps to understand that we want to balance being cautious to avoid a resurgence or a second wave of the virus, especially in the fall, with the practical considerations of living our lives and needing to do certain things to live those lives. There is direction from the PA Department of Health about how we should conduct ourselves in the green phase, and I would urge all members of the public to go to the PA Department of Health website and to read the recommendations for the green phase, rather than hearing it through a third or second-hand source. In general, in the green phase, the PA Department of Health tells us that stay-at-home orders are suspended. There's guidance on occupancy limits and health and safety orders for specific businesses. For example, personal care services such as barbers are by appointment. Any gathering larger than 250 people is prohibited. For example, concerts, fairs, festivals, and sporting events. And by the way, it's noteworthy that churches, synagogues, temples, mosques, and other places of congregate worship are specifically excluded from the limitations. But the institutions are strongly encouraged to enforce social distancing and mitigation, such as wearing masks. And from what I understand from talking to some of the faith leaders in the community, they are doing that through their own congregations, either taping off areas, asking people to sit so far apart. Visitation to prisons and hospitals may resume subject to the decision of the facility. And today maybe we'll hear from UPMC what that facility or has others that they know of. But I think the bottom line is that we're encouraged to continue to use common sense. We know that the coronavirus is a highly contagious virus that spreads through breath and saliva, and especially spreads through congregate circumstances, whether it's congregate living or gathering of people together. We also know from history that pandemic viruses often have a resurgence or a second wave. Just one example of this is the 1918 influenza pandemic, which actually had 3 waves. It started in the spring of 1918. It peaked in the second wave in the fall of 19. Actually, that's when most of the U.S. deaths occurred. And a third wave occurred in the winter of 1918, and the pandemic eventually subsided in the summer of 1919. Now, we know that World War I really led to a large spread of that virus, but in my own mind, the ease at which we conduct travel today, especially international travel, substitutes in my mind for what happened with World War I, where people were brought together. So again, I think if we understand, and I actually hope the doctor from UPMC can shed light on this, a virus doesn't live on its own. You know, it needs a host. And if you go back to your biology days, it needs a host in order to survive. So that to the extent that we eliminate the host, or the transmission of a host from one to another, to that extent we hasten the virus's eventual ability to survive, and get back to what Commissioner Metzger said. So in conclusion, the green phase, in my mind, tells us to exercise caution combined with common sense, with an understanding that we do all of this to protect the most vulnerable. Those who have underlying immune systems of all ages, are seniors, are veterans. You know, many people who have other medical problems going on. Although we may not be required to wear a mask, we can do so. Although we may be able to go to an event that has 150 people there, we can choose not to, and thereby, again, deprive, if the pathogen is there, of possibility of a host. So I'm encouraged, but cautious. And I'd like to introduce our President Judge, Nancy Butts, who can tell us more about the court situation. Thank you.
Thank you, Commissioners Metzger and Mirabito. Excuse me. Just an update as to what the courts are planning in this new phase. As we've indicated by the administrative order that I've issued, that through the end of June, we really want to try and do as much as we can by alternative communication. That would be by Zoom or conference call, or encourage people to file their paperwork through the U.S. mail or drop them off at the courthouse, as opposed to wanting to come into the courthouse. As Commissioner Mirabito said, one of the issues is congregate groups, and especially at this time of the year, the courthouse is a very popular place. It's usually cool. People like to come in and they like to visit people that they may not have seen in a while. So we're really just trying to discourage, at least through the end of June, a lot of unnecessary foot traffic. So if it's possible to do your business at the courthouse in an alternative means, like by the mail or by Zoom, or participate in that way, we would encourage you to do that. We've got adult probation and juvenile probation are still meeting their clients out in the field, at least through the end of June. So if you are currently on supervision, please wait to hear from your probation officer, and they will be meeting you out in the field. If you have business that you need to attend to in the domestic relations office, they are still handling business, but by appointment only, as they have been doing. Just wanted to highlight, because pretty soon people are going to know that jury trials are going to start back up. They've actually started in different places throughout the Commonwealth of Pennsylvania, but this obviously would encourage large numbers of people to come into the courthouse, because we need to select a jury, and often those jurors are gathered in groups of 50 or more. So I just wanted to highlight the safety measures that we're taking in the courthouse to protect those of you who may receive a summons for jury service in July or August. That start times will be staggered, and the time between proceedings will be increased to minimize person-to-person contact. That only necessary participants will be allowed in the courtroom to minimize not only the number of people coming together, but the fact that we want to still remain socially distanced from one another. Participants will use the hand sanitizers that are in all the stations around the courthouse, in addition to on each elevator station throughout the building. Highly touched surfaces will be cleaned and disinfected as practicable throughout the day, and that each courtroom and each hearing room, and if jurors are in, then the jurors' lounge would also be thoroughly cleaned and disinfected in the evening. So when we start up with the next day's business, the areas will be clean. So that is just basically the highlights of the information that we wanted to make sure that you were aware of through the courts. What I'd like to do is introduce to you right now the head of the Infectious Disease Department at UPMC Williamsport. He has been a resource even to the courts in terms of helping us make a determination as to how to proceed and how to roll people back into the courthouse. So I would introduce to you Dr. Rutul Dalal.
Thank you, President Judge, and thank you so much for having me here. Thank you, Commissioner Mirabito and Metzger. So let's start by giving you an update so far what we have done at our facility and what is the strength of our recommendations so far, which have been pretty well in sync with the CDC. So since the start of the pandemic, UPMC has discharged more than 500 patients who were safely treated and recovered from COVID-19. That's 5 times as many as we have hospitalized across the system, across 41 different hospitals. All signs show that the virus is less prevalent today, and as depicted, we have moved into the green phase because we have had almost a plateau and now a decline in the number of new cases. We have tested widely, including using a UPMC test that also performed very highly effectively, as well as other tests as well, even before COVID-19 became a pandemic. In total, we have performed around 30,000 tests system-wide, and the positive rate was less than 4%. That means a vast majority of the patients we suspected could be having COVID-19 were negative. We have performed nearly 8,000 tests to date on patients without any symptoms who are coming in for care, either for some kind of procedures or going into our ORs. And overall, only 21 of those tests came back positive, which means that we have around 1 in 400 patients who are asymptomatic who had the test positive. To put that in perspective, your chance of getting into a car accident is way higher than being positive if you have an asymptomatic person with COVID-19. Most of the areas where UPMC serves have moved into the green phase based on the governor's plan of reopening. And this currently does not change anything for UPMC, except we are getting back to the same number of patients which we were seeing, both through our emergency rooms, as well as people coming in from different areas of the state for different procedures. We are back to treating the same number of patients even in our own in-house hospitals as well. At the height of public concern, UPMC was caring for almost half the patients who were coming into care. And from 50%, we are back to almost 97 to 98%, inching towards 100%. So as of now, we think that, with the help of our local leaders, we have controlled the virus in our communities, and it's time to move to a new restored approach to human interaction and safe reopening of our businesses. As of now, I would say the rapid return of patients to our hospitals and care sites reflects the pent-up demand for getting hospital care. Because we were observing that people out of care really did not want to come into any healthcare facilities because they thought they'll be exposed to the virus. As of now, we can assure you that all of our campuses are completely safe. Temperature checks are being done at the entrances. A questionnaire has been done at the entrances as well, so to ascertain the risks. And of course, our employees as well as janitorial staff are completely cleaning all areas of the hospital with adequate EPA disinfectants. So as initially was told in this meeting, that we need to move to the green phase in a staggered approach. Of course, we need to be cautious. Social distancing, masking where social distancing cannot be done would be definitely a long way to go to help us get over this. Now, unfortunately, across the country, across states, as well as major cities, we have been seeing a lot of protests going on. That also puts us at a little bit of caution. We have to pay heed to this because there could be a mini surge in the next couple of weeks. But that doesn't mean that we stop living our lives. We still have to go on with it, of course, in a cautious way, because this virus is not going to go anywhere. As the commissioner just said, that there might be a late surge again in the fall and the winter months. We have to be careful of what we do, and we need to learn to live with this virus safely so that we can keep our families, our businesses, as well as all our communities safe. And as always, we're always available to answer any of your questions. We'll probably field questions from our local leaders, and UPMC is committed to providing a safe environment for everyone. So as of now, I would just say please enjoy your summer, and we'll be keeping a close watch on this virus, and we'll be ready to safely care for you and your communities. And I should say, just use some special common sense, social distancing, hand hygiene, and stay home if you're sick. That will go a long way in protecting all of us. Thank you for having me.
Good afternoon, everybody. My name is Jason Fink. I'm with the Williamsport Chamber of Commerce. And I'll be honest with you, I think Lycoming County has done a phenomenal job in being able to adhere to the guidance that was put out there by the state very early on. Think about the numbers that we have. We've got roughly 180 people in Lycoming County that were diagnosed with COVID-19. That is 0.15% of the population here in Lycoming County that's been diagnosed with that. I think that's something that we all need to pay attention to. We started masking a couple weeks back. Prior to that, we weren't doing any of that. We were out doing commerce. I will tell you, I've witnessed the lines that were out at major retail outlets, and there were people there doing commerce. From that aspect of it, I think we were able to do it very well, and being able to adhere to the guidance that was put out there. I think people were listening to the fact that they needed to social distance, that they needed to wash your hands. I know it's very basic, but it's some of the things that I think that people kind of got away from and now are back to doing. I've got kids. When they get home from school or playing with friends, it is make sure you're washing your hands. So the fact of the matter is there's some basic common sense, and I think the doctor commented on that. We need to live life now. And beyond the green phase, which I will be honest with you, I think we need to be moving beyond the green phase. We've demonstrated the capacity to be able to adhere to the guidance that's been put out there. We do need to get back to living. Businesses need our support right now. The fact of the matter is there's a lot of things that are required upon us to be able to have a thriving economy and a thriving government. And those are taxes. You can't tax businesses if they don't have people coming in to acquire their goods and services, because they don't have the revenue to be able to do that. So we need to get out there and we need to start living our life again. And we need to do it with common sense. And the common sense is wash your hands. And I'm going to keep saying that because the fact of the matter is it's all you need to be doing right now is being able to do that. Be smart about it. If you are sick, don't go to work. You know what? You don't need to share your germs with people. It's common sense. We also need to be back living. We need to be doing things again. We need to be experiencing our life. You know, paycheck is okay, except for the fact that if you can't use it on things that are able to be purchased with that paycheck, it's not a good thing. We need to live. We need to go experience our community. We need to support our community. Right now, that is the important thing. You know, I will say I get disappointed when I'm out in the mornings. I ride bike early in the morning, and I see the Amazon blue trucks with the big smile on them. I get very disappointed when I see those because that means that that is taking away from our local economy. People need to be buying locally. You need to support local businesses. If it's a place that you can buy something for a couple cents more or a couple dollars more, support the local business. This is now more than ever we need to be doing this, because the fact of the matter is those are the businesses that pay the taxes here in our local community that give us the ability to take and enjoy the quality of life that we have here. Being able to take and look at those businesses who we go to, if you're a nonprofit organization, if you're the cancer group or you're doing some type of run or support endeavor, fact of the matter is you're out asking local businesses to make sponsorship donations. Right now, those businesses aren't in a position to be able to support those because we've shut them down. It's time to get them back. It's time to get them thriving. We now need to support them. So with that, I will just leave it with the fact that it's time to get out there. It's time to live. It's time to be able to experience our economy. And I'm going to turn it over to Mr. Kiesling here to be able to give you an update from his perspective. Sheriff, I'm sorry.
I'm at the corner.
Sorry.
Sheriff.
I wasn't paying attention to where you're pointing. Sorry.
I used to be the chief deputy coroner.
Oh, see?
He's disappointed that I'm gone. Aren't you, Chuck? A couple updates from the sheriff's side and the security side. On the LTC side, we're not only taking walk-ins at the sheriff's office on license to carry. You would have called them in back in the old day. Gunslingers, gun permits. The LTCs are coming in by appointments, and they're coming in if they choose to walk in without making an appointment. It's been busy for those that are going to be coming in now, probably more than in the past 10 weeks. We're not going to turn folks away so we can get your licenses renewed. The deadline for that, for license to carry, if your license expired after, I think, March 17, is July 31st, but we have about 800 backlogged that have not renewed since they would have expired after March 17. So we're trying to catch up on those. That's a busy operation. On the civil side, we're taking walk-ins, we're taking mail through the U.S. Postal Service or the other carriers as often and as frequent as much as they want to come in. So civil service is virtually back 100%. Also, on the 3rd Street Plaza side, we coordinated the effort of the Lycoming County Prothonotary, Tom Heap, and the Lycoming County Register and Recorder office. They are now operating out of their own individual offices. We're no longer providing a satellite office at 3rd Street Plaza. So that was closed as of noon on Friday. So anyone have an interest there, as far as coming in using computers, they would contact either the Prothonotary's office or the Register and Recorder's office. On the emergency operations side, with protection from abuse orders, we have always been providing service to the court because the court has, that's one core service the court has continued to provide through the past 10 weeks. So we're still providing service for protection from abuse orders, as well as the emergency custody orders or the guardianship orders We've been doing it all along, and we continue to do that and provide those services. On the warrant side, we're now starting to get additional warrants from our magistrate district judge level. I anticipate this week, my staff has indicated, we'll probably receive in excess of 100. So that backlog is starting to flow. We'll be providing service for, on the warrant side, as quickly as we can. The other comment is, if you're coming into the courthouse, protocol for the courthouse is, if you're going to be in the common areas and in the hallway areas, you'll have a mask. Our deputy staff on our security division side who screen you will ask you to make sure you have your mask on. If you happen to forget your mask, we will provide a mask to you, but it doesn't mean you put the mask on and take it off in the hallway. So you keep your mask on in common areas. Individual offices can make their own decision if they require you to keep the mask on in their office or their department. But coming into the courthouse, you need to have your mask with you. And with that, I will turn it over to Director of Administration McDermott.
All county employees have returned to the traditional 8 or 7.5 hour per day shifts. Each department continues to determine their respective operational and resource requirements, submit those via COVID ops and COVID request emails. The planning coordination cell will assist in prioritizing all the operational and resource requirements across all county operations. We continue to evaluate all guidance and information that's disseminated by the CDC, the Governor's Office, AOPC, CCAP, and PEMA for all best practices, and to be able to share that with all departments with respect to their individual operations. As you've heard many before, it is requested that all visitors wear masks when entering county facilities. The use of appointments by the public remains highly encouraged. All county employees are required to wear masks in all common areas and when interacting directly with the public. There'll be increased cleaning of general areas of county facilities throughout the day, and each department has been supplied with infrared thermometers in the event that a staff member falls ill during the day, to be able to evaluate that employee. I'd like to make a comment on behalf of the Register and Recorder, Dave Huffman, who's unable to attend. He asks that you please go to the Register and Recorder webpage. Schedules are posted, and relevant, clear, and concise details are also provided for direction. He states that they are operating by appointment only for all areas in the office: probating, marriage licenses, notaries, and other areas. He wants to thank everybody for their patience and understanding throughout this crisis. We've worked hard to provide the satellite operation for the public at 3rd Street Plaza and to provide free viewing on PA land records as an extra value-added service. Additionally, the drop box out front as a value-added service, which we encourage use of at least until 15 June, so that the public does not need to make appointments to do recordings. And they still encourage the use of mailing services. That's all I have. We'll take any questions that you have at this time.
Any questions? I'd also like to add thank you to our voter registration for Slayman and his staff, and all the poll workers did an amazing job last Tuesday with an election that threw all kinds of curveballs. They did a great job. There's several counties throughout the state that are still just starting to open up ballots, and his staff, what they did on Tuesday night and Wednesday is nothing short than a miracle. So we want to thank them and all the poll workers out there. All the sites we had defogged when we were finished with the sites, so we took the precautions with those sites also. Commissioner Massar could not be here today. He had a prior commitment. And the last thing I'd like to add is we've had, our citizens have been extremely responsible through this whole pandemic. And it's evidenced by the fact that we've had 19 new cases in the last 21 days, which is just tremendous, and we have much more increased traffic. I think it's a couple different factors. Number one, the citizens have been responsible. Number two, we live in the largest geographical county in the state, 79 people per square mile in Lycoming County. Some parts of the county we have 17 people per square mile. So the fact that people are spread out also helps. The fact that we're not giving it to each other through the pandemic, such as very metropolitan areas that we've seen the major outbreaks. But it is true, like the doctor states, this virus isn't going away. We're going to have to live with it, but we'll be ready for it when it comes back, and we'll be cautious and responsible as it returns. At the same time, we're not going to shut down. We're not going to be to the point where we're going to have our rights violated, and we're going to do things responsibly and move on in the right direction. We don't know what that new direction is going to be because there's no clarity from the state. But as hard as we fought to get into the green phase, as the commissioners drafted a letter and sent it to the governor a few weeks back, all three commissioners signed on that letter, that we did not understand why we were in yellow, we should move forward. The next day, after he said no, we had a discussion with the Department of Health and showed us our numbers are very comparable to Center County. And they went back, and that Friday we got the word we were going to reopen. And since then, other commissioners across the state have done doing the same thing that we started to do initially. Union County and Northumberland County followed our lead. Very unfair what was going on in Union County. They had even less cases. And they did the same thing, wrote a letter to the governor, and their county is going to be reopening green as of Friday. So we'll continue to be very proactive. We're going to fight on behalf of the citizens in this county. We're not going to lay down and have things mandated and told what we're going to do. We're going to do it responsibly because our citizens are adults. They know how to make decisions on their own, and we'll do so according to CDC guidelines and do it responsibly. So thank you for attending, and have a great day and stay well.